I just checked the patient's glucose and it was 252. So I have left the room, I've taken off my gloves, I've re-washed my hands, and I've left the room. And now I'm in the medication closet and I'm about to pull his insulin. First thing I do is I'm going to go to the MAR and check what the doctor has ordered for the patient's insulin and that level, and he's ordered 16 of NPH and 6 units of regular insulin. So I'm going to go ahead and check that, verify the patient, and get that out. So I got the insulin. I'm going to go ahead and clean my hands, put on clean gloves, and I'm going to check these insulins that I got. They're 6 units of regular, 16 units of NPH. I'm going to check the expiration date, and I'm going to go ahead and roll these in my hands. And then I'm going to take an alcohol pad, and I'm going to clean the top. And now that they're clean, I'm going to take my needle, take it off, and I'm going to put in 16 units of air, and I'm going to put it into the NPH. Okay, and then I'm going to come back out, put in 6 units of air, and put 6 units of air into the regular insulin, and then immediately draw back up 6 units. And then I'm going to go back to the NPH and immediately draw up 16 units of the NPH. And while I'm doing that, I'm also making sure that there's no air bubbles and getting all those out in the process. And this needle should now equal 22 because 16 plus 6. And so I'm going to recap it. And now I'm going to label this because I'm outside of the patient's room, and I'm going to verify this again with a second nurse to make sure it's right. So now we're going back into the patient's room, and we're going to wash your hands, and we're going to the patient's room. We're going to re-verify the patient through the MAR, verify the order, and we're going to check for a third time that we have the correct dosage and patient and medication. So now we have clean hands, clean gloves on, and we're going to administer. So we have decided to administer this in the abdomen because the last place we had it was his arm. So we're just going to put this in his abdomen on the left side, about 2 inches from his belly button. So first we're going to just clean the site, make sure it's all clean, and then we're going to take the needle and we're going to pinch with 2 inches and insert at 90 degrees and inject slowly. And then we're going to take this, discard in the sharps, and clean with the alcohol pad. That's it. And then we're going to take off our gloves, wash our hands, and we're going to document.